Hi everyone, I'm Alicia, and today I'm here with Dr. Duran from Rockside Family Dental Care. How are you doing today?
Good.
Good. So in this video, we're going to be talking about endodontics, which is also known as a root canal. So what can you tell me about this?
I think everybody, it's such a scary term.
Yeah.
They hear root canal and think that it's some painful surgical procedure, and it's really just like any other dental procedure, like a filling or a crown. I think just really, it can be painful if you're not numb, but that's why we focus mostly on the most important thing, making sure that the patient's comfortable.
Absolutely.
Totally numb for any procedure, especially a root canal.
Right. Awesome. So, we have a little diagram of the treatment. So what can you tell me about that?
Okay, so basically outlining what a root canal is, inside the tooth is the pulp, which is the nerve and blood vessels inside of the tooth.
Okay.
And if they get damaged in any way, be by a cavity, a cracked tooth, they'll cause pain. If they're left untreated, then they can cause infection, or we call an abscess. So the way that we treat this is you want to clean that pulpal tissue out from the center of the tooth so that you relieve the patient from their pain and you eliminate the possibility of an infection or an abscess from occurring.
Okay.
And that basically is what a root canal is. They call it a canal because it's a tube that runs down the root. You clean it out, and then you basically, very simply, you seal it up.
Okay.
At the very end of the procedure, showing on the bottom right, you'll put a crown over the tooth to protect it.
Okay, got you. And then, so if I have something like this going on and I haven't come to the dentist yet, will I know because of the pain or swelling, or maybe I won't know?
Most of the time you're going to have symptoms of discomfort.
Okay.
So extreme hot and cold sensitivity, throbbing pain, referred pain. Sometimes you can have pain away from the tooth. But there are instances where it's not symptomatic and the first symptom the patient has is just swelling.
Oh, okay. So it's definitely important then at that point to call your dentist, call Rockside, and get those services lined up.
Exactly.
And then on the screen here, we see an actual x-ray of this procedure. So.
Yeah, so what this is showing is kind of a before and after. On the left, the blue arrow, it's pointing at what we call the pulp chamber. That's where the nerves and blood vessels live. And the black arrow at the top is showing that kind of dark black area. That's the abscess. That's where that infection is at. So then on the right side, we see where the white lines are. Those are the canals that have been cleaned and filled. Okay. And that's the filling material you can see on the x-ray. And then the blue arrow at the top is showing that black area has pretty much gone back to normal. So this has been a successful procedure. The patient's healed, and we can move on from there.
Great. So, we're talking about the procedure. I'm just kind of wondering, how long does this procedure typically take?
It varies. It can be very quick. It can be 10 minutes or it can be 45 minutes, depending on the complexity of the tooth. So for example, we have this image showing some fairly curved roots. So this one took a little more time, plus it's further in the back of the mouth, so access is a little more difficult. But regardless of how long the procedure takes, as long as you keep the patient totally comfortable, it's actually a fairly simple procedure. Okay,
so it varies per person depending on the curvature of the roots.
What tooth it is, yeah, they're different. Okay. Most of them are fairly quick.
All right, well, thank you so much for telling me a little bit more about that. And if you'd like to find out more about Rockside Family Dental Care, you can contact them. You can call them at the number on the screen, or you can visit them online at rocksidefamilydentalcare.com.